When choosing surgery, understand full costs, prioritize safety, and make informed decisions. Let's hear from DRB and Jessica about our quoting process.
So one of the things we wanted to do is we've gotten a lot of feedback lately when people will come and they'll receive a quote and they'll say, when I go on Dr. Google, it says the price is X, Y, or Z. And so I thought we would take a minute and clarify what that means. Oftentimes, and I've brought Google up on the screen in front of me, the price they list may just be the professional fee, not including anesthesia or facility or the implants or the disposables. And that all adds up. We will often ask patients to bring us quotes from other practices. We are not in the price matching business, but we are happy to explain at least what's included or what's missing from that particular quote. For us, safety first. So we're going to go to a fully accredited facility. We're going to have a board certified anesthesiologist, and we're going to have the best people I know to have around the table for your safety. And that's not the focus of every practice. That's not to say that they're doing things against you. It just means this is our fundamental baked in philosophy of how we want to do business. That takes time and effort. All of the time we spend educating our patients. The average consult's about an hour. Your pre-op visit is also about another hour. And we get people all the time in the world, they want to ask questions before we get to surgery. Next, we collect on behalf of all of the entities. So rather than having the patient pay us, pay the facility, pay this, pay that, you pay us one number and then we pay out all the vendors. And we feel that's a convenience for our patients, but it makes it look like there's a big number to us, but in reality, it really gets parsed out to the different folks. I can't remember if I said this once before. We had filmed this on Instagram Live and then lost power, but we're not in a price matching business, but if you wanted to bring your quote from another physician, happy to compare, to at least say, hey, this is what you're getting here versus what you're getting there, and then let you make the best decision. Are there other obstacles you think you're encountering or other things you'd want folks to know?
Google isn't going to have that exact number. I've seen with several patients, they have a number in mind, so I look it up because I want to help them and see what it is they're seeing, and the price isn't including the anesthesia and the facility. It's purely the surgeon's fee, and most of the time that matches up right where we're pricing them for Dr. Baumholtz's time.
And I think there's something to be said. You've been doing this for a long enough time. You kind of get a sense of what your time's worth and what you need to run a business, and that's where the number is. There's always someone that's going to do it for cheaper. That doesn't necessarily make it the right answer. I would strongly encourage folks who are considering elective surgery to really do their homework, aside from just looking at the number. Not that the number's not important. I'd be hard pressed with such a big decision to let it drive the entire process. We see a lot of folks who travel for a certain price. Now, if your mom went there and your sister went there and you knew the surgeon, great. Mazel tov. But if you went just because the number caught your eye, that more often than not does not lead to viable outcomes. And so we see a lot of people who have gone someplace else chasing a number. They're pretty dissatisfied, and it's kind of a more challenging thing to fix. So let's do it right the first time. All right. Anything else?
Nope.
Thank you, boss.
Yep.
Thank you, everyone. Talk to you soon.
See you later.